Hey guys, it's Mike, certified brain health coach, and Dr. Sparer bought a home hyperbaric oxygen chamber from me. He has agreed to share some of his testimony about his own personal condition and how it helped him. So, Dr. Sparer, first of all, when did you start becoming aware that, or seeing the science on how a hyperbaric oxygen chamber could help with your condition?
Well, it was July of last year. Uh, I had gone to a cardiology appointment. They did a stress test on me, and they determined that I had congestive heart failure. I went to the hospital. They put in 2 stents. It was a bit of a hot mess. I chose not. I opted out of having open heart surgery. Opted for 2 stents. Ultimately, I ended up with a third stent from Mayo Clinic. But the bottom line on this was I was given a diagnosis from the first cardiologist of congestive heart failure, and that I'm going to have it and I'm going to die, and that's that. And it was kind of a death sentence. And me being the holistic health kind of guy that I am, I refused to accept death sentences. And I wasn't going to accept that. So I started doing a little research. And the next day, when I was back practicing, it was about a week after I came out of the stents and started practicing again. And one of my patients remarked to me he'd just been in a hyperbaric chamber. It was a hard hyperbaric chamber, and he'd been doing it regularly for his health. He said, "You might want to look into this." And so, of course, I began to research this and studied, I'm trying to think of the name, Paul.
Oh, Paul Harch.
Paul Harch.
Yeah.
I got his book. One of my patients handed me his book.
The Oxygen Revolution.
Right.
Is that the book?
Yes,
Yeah.
that's the book. So I
It's a
read
great
that
book.
like a maniac, read that, started researching, looking on the internet, and there's a lot of data on hyperbaric chambers, and the heart chambers are pretty much present in most hospitals in the United States today. And I was taken aback. I said, well, I started looking into the science behind it. And the science behind it is, for a layperson, is very simple to understand, let alone for a doc. Essentially what happens is your bloodstream, your plasma, and your red blood cells both are capable of carrying a certain amount of oxygen at normal air pressure with the normal amount of oxygen in the environment. And by going into a hyperbaric chamber, you can increase it by 5 times or more. So the carrying capacity of your bloodstream goes quintuples at least when you're in the chamber itself, because you're breathing pure oxygen and it's under pressure. And there's a simple principle in physics, whereas when you increase the pressure, you increase the carrying capacity of the red blood cells and the plasma and the bloodstream itself. So it's pretty simple and elementary. Now, if you think about all the human conditions that people have, having more oxygen in your body is only going to help those conditions, whatever they are. So my reasoning was, even though there's no data on congestive heart failure, I would include it in my treatment regimen. And my treatment regimen was medication prescribed by a cardiologist at Mayo Clinic, 1. 2, my standard diet, which is a really clean vegetarian organic diet, which I've had for 46 years. So I didn't have to change that. I just continued it. There was an exercise regimen where I was on a treadmill going over 3 miles an hour for a period of 30 minutes with 1 break. So 2 15-minute increments. My smoothies that I do, about 2-3 times a week, almond milk smoothies. And those are on my website, the formula for those. And the hyperbaric chamber. So all these things combined, because you can't put a finger on one thing that made a difference, but all these things combined got me to the point where the cardiologist at Mayo Clinic said I no longer have congestive heart failure. So my heart returned to its normal size from enlarged, and the circulation, when we measured it with echocardiograms, returned to normal.
Do they measure it like with an ejection fraction? Is that?
Yeah, ejection fraction at its worst was 23%, and is now returned to 45%. and 45% and above is considered normal.
That's great.
And it will continue to improve as time goes on because I'm continuing this regimen. I'm going to rebuild my heart better than it was. Now, just as a point of information, how I got there is very curious. I have a genetic condition where I make too many low-density lipoproteins. And the body, when you make too many low-density lipoproteins, decides it's going to manufacture cholesterol in your liver, even if you haven't eaten it, and then deposit it because it's in excess because you have too many LDLs onto your coronary arteries. So I actually ended up with a coronary artery condition, not based on diet, not based on cholesterol intake, but based on a genetic dysfunction. There's a medication I take that's a special medication that actually neutralizes the low-density lipoproteins via antibody. It's a milliliter I take every 2 weeks by injection. It's a little pen, and my LDLs and my cholesterol is back to normal. Where it was high before.
What's the name of that medicine?
Well, there are several varieties of it. There's one company makes it called Repatha. Another company makes it, it's called Proluent. And there's a third one also, I think, that another company that makes it. So it's a fairly commonplace medication if you're up to date. But the good news is that this system that I'm using now, I'm in excellent health, much more excellent health than I've been in decades, and I'm 70 years old.
That's what I was going to ask you.
Yeah, I'm a 70-year-old man.
Yeah.
I just turned 70 a couple weeks ago.
Wow.
So, yeah.
How often do you use the chamber?
Every day for an hour and a half.
Hour and a half.
Yeah.
Do you do it in the morning?
I do it in the evening. I like to do it at night. I get done treating my patients. I have hours until about 9 o'clock. And I relax for about 15 minutes to half an hour. And I change my clothes into some nice comfy jammies. And you'll have to take a look at my my layout. You may put the camera on it and take a look.
Yeah.
I've got a really comfortable box underneath it, a plywood box that I had someone build, and I have a half a king size mattress underneath there. So when I'm laying in the chamber, because I lay down in this chamber, I'm super, super comfortable. I take in a tablet with me and my phone in with me, and some hard sucking candies that are sugar free to keep my mouth moist because you can't bring water in there and drink it. And I'll just sit for an hour and a half and catch up on email, play some games on my phone, watch some TV or streaming content on my tablet. And I while away an hour and a half of relaxing time laying on my back with an oxygen mask on, breathing in pure oxygen under pressure.
Nice.
And it's super relaxing. I come out of there, I'm relaxed.
Do you use a mask or a cannula?
I like the mask. I happen to like the mask because I'm getting full oxygen. The cannula, I think it limits somewhat the pureness of the oxygen.
I'm a cannula guy.
You like the cannula?
Yeah, I'm a nose breather, and I just up your nose with a rubber hose.
Okay. Okay, Mr. Cotta, thank you. Welcome back.
So how soon did you start seeing some benefit from using the chamber?
Well, the first thing that happens when you get in a chamber is you have a Herxheimer reaction, or you Herx. So what that means is that all the bacteria that are anaerobic in your body start to die off. When you get a die off, you kind of feel sluggish and you feel pretty spaced out. And I had that for about two days or so.
Did you have any rashes?
No rashes, nothing terrible. Just kind of loggy and spacey and that sort of thing. But, I knew I was having it. I have a Epsom salt bath. I have a nice clawfoot bathtub. I got in that. Took an Epsom salt bath every day, a couple times a day. And I got in my jacuzzi, and I let the jets go full bore on me. And between the two of those things, in 2 days, that vanished. And I was then starting to get benefits. The first was I increased my mental clarity. The first thing you notice with a hyperbaric chamber. And the next thing that happened after that was I started to become more vital. I had more energy. I felt better, just generally as a whole. In terms of wound healing, if you go in the hyperbaric chamber, you've got any cuts or wounds, they heal quicker. And again, this is used in hospitals nationwide for wound healing. It's just remarkable what it does. Now, as time went on, I found my recovery time increased. At that time, I was getting monitored because I just had the stents. And I picked up that chamber in about September from you of last year. We're now in September of this year. So it's literally a year, not a few
Has
months.
it been a year
Yes.
already?
Time passes when you're having fun.
Jeez.
And so in September, what I started to notice, because I was on constant monitoring while I was on the treadmill in a hospital setting, because I was recuperating from the 2 stents that I had put in. They hadn't added the 3rd stent yet. And what I began to notice is my recovery time when I got off the treadmill, my heart rate went down much quicker to normal. I also noticed my heart rates, because I have one of these watches, and I monitor my heart rate with it constantly per my nurse practitioner's advice. And I noticed that my heart rate returned to normal, and it was much lower when I was waking up in the morning. It went from being in the 80s when I first started with the hyperbaric chamber to resting heart rate in the 60s.
So from the time that you bought it, you had a concussion?
About a month and a half, 2 months ago. And my recovery time was about 2 or 3 weeks.
So did you use a specific protocol for the concussion, or you just kept on business as usual, doing it every day?
Same day, every day.
Mm-hmm.
Same deal every day, rather. Yes.
Share with me when you got the concussion, how you rated your pain and general feelings from 1 to 10 to 2 weeks later.
Well, I would say that for the concussion, there was brain fog that was associated with it. And in addition to the brain fog, there was dizziness. Those are the 2 main symptoms. And those symptoms, when I was in the chamber, would decrease. Now, they would come back, and there was still swelling. It took a while for the swelling to go down, which is what causes the brain fog and the dizziness. And it took a while for that to go away, and some of it was positional. I also got adjusted. That helped. The kind of chiropractic, directional non-force technique chiropractic that I practice, I had to go to Santa Barbara to my friend Linda, and Dr. Linda was great. She treated me for a week, and the positional dizziness went away. But the general dizziness still persists on occasion, although now it's gone, but it persisted on occasion for several weeks afterwards when I was tired. And what I learned when I had my lacuna stroke about 8 years ago was that with a stroke, the symptoms return when you get tired. So I presumed, I believe correctly, that with brain function, same thing, you've got to get enough rest to get restored brain function.
Have you had concussions in the past?
No, that was the first time I jumped to one.
Oh, I've had a couple of concussions in the past, and I feel like my chamber has done wonders for me.
So what happened with the chamber with you?
As in, like, why did I
No, what did you notice?
So I got a concussion in my kid's football game. We were packing up the wagon into the Suburban, and I went into it, and I hit my head on the top bar of it, and I had a large scrape. And
mine was a slip and fall on a wet floor.
I
landed on my head.
A dullness pain,
yeah,
a throb, some dizziness.
Yeah.
And so I just started using my chamber.
So yours wasn't as bad as mine. I was like, the room was spinning, kind of dizzy.
I did
several days.
Yeah, I didn't feel nauseous or have dizziness or spinning or anything like that. I did have a little dizziness, but I think I recovered remarkably from using my chamber every day for a couple of weeks.
Yeah. That's a good deal.
It was so nice to have. Yeah. Any other benefits that you've seen using the chamber?
I think in the long run, there's going to be benefits just generally with the BPH. I think down the road, I think I may see something. And down the road, I may see something with diabetes.
Interesting.
Down the road.
Yeah.
But as far as I'm concerned, I need to keep increasing my heart function because it was pretty compromised at 23% ejection fraction. That's half of what it should be.
Mm-hmm.
And it was And I looked at that circulation, and he showed me the echocardiograms and the blood flow to my heart before and after. And it was pretty remarkable.
That's great.
Now,
That's
some of it
wonderful.
was the stents, some of it was the meds, some was the exercise, some of it was the diet, and some of it was the chamber.
Mm-hmm.
So, you have to remember that when you're going to use the chamber as a tool, it's a tool. You can't do one thing and expect that's going to be the only thing you have to do. You have to look at your whole body, and you have to analyze it, and you have to see what's going on for real. You can't just say, oh, I have the magic bullet. It fixes everything. The hell with taking care of myself. I don't have to anymore.
I agree. I think it's one of many things that helps, and probably the most beneficial thing came from what your doctor did, what your cardiologist did.
The stents?
Yeah, the stents,
they were massive,
and the medicine.
but I had already incurred that damage over 65 plus years of this genetic disorder that went undiagnosed.
Mm-hmm.
But the point I'm making is that everyone in every household should have one of these as a healing tool, because it will always come in handy. You can always use it.
So, quite frankly, in the beginning, I feel like you and I have become buddies over the past year. But in the beginning, it was really a business transaction.
Mm-hmm.
I sell medical supplies. You're looking for a product.
You had good reviews.
And so,
you had what I wanted. I knew what model I wanted. I knew what type I wanted. I found you. We talked. But then we became pals.
Mm-hmm.
But that's a bonus.
So how was the business transaction for you from a customer standpoint of like me selling a product to you?
About it, okay? Now, when someone charges a big mega $1,000 deal on something, there's a lot of ways they can manage it. And the way you choose to manage your transactions, and I've heard from other people also, there's a certain amount of consciousness to what you're doing, number one. Number two, you realize that the person you're dealing with is a person. Number three, you want to help. And you have a desire to help the person far beyond the economic transaction part of the deal. And finally, your ability to service this and your diligence at serving me as a client was remarkable. And, recently I had a zipper fail, which can happen. I mean, manufacturing defects happen. And the zipper failed about maybe 10 months into owning that. And Newtown was great, and you were great, because within a couple of weeks, I had a new chamber and a better chamber. Not better in terms of the price level of it. It's the same chamber, but the chamber is better now because they made improvements on the chamber with the zippers to prevent these kind of defects from happening in the future. So they're very diligent also, as well as you. You're very diligent also. So I highly recommend that kind of chamber. And I highly recommend you as a provider, because you follow up, you make sure things are right. And frankly, when I bought this chamber, it's remarkable. I'm going to pause, and you'll be able to cut this and clip it.
It's almost better just to keep it in. I mean,
okay.
Keeps it real,
Okay. Yes, anyway, I have an office. I actually treat patients, and I get busy. And they call for appointments. So back to what I was saying, part of the diligence is involved in service. And part of it is in just following up. When you came in at the beginning to put it in, you showed me how to do it. You set it up. You showed me how to operate it. All you had to do was sell it to me and say, here, I delivered it. Goodbye, it's in the box. You didn't. You set it up. You made sure I knew how to use it. You made sure I could get in it myself, zip myself in and run it, and unzip it afterwards and get out. And in addition to that, you gave me a whole handful of masks and cannulas that you just gave me, that you didn't have to, but I appreciated it. Cool. So it's just, you get 5-star service, it matters. And it's good to be able to get that. And I'm sure any supplies people get, they get that kind of service.
Yes, I try to as best as I can. And thank you for those kind words.
Sure.
Yeah, that mean a lot. Thank you. So, I don't. So, what do we end with? What do we say? Like, thank you so much, and
You're welcome.
have a great weekend.
Yeah. And take a look at my layout too, because
Yeah, let's
people
do that.
may benefit from having this layout. They may want to build a layout like this. The layout, why don't we stop for a minute and we'll go in there and I'll show you the layout and I'll talk about it
Perfect.
while you're looking at it.
That sounds great.
Okay. So what I've got here is the replacement Mike brought for me today of the hyperbaric chamber. It had a defective zipper. And as you can see here, the zipper is changed and it's a better zipper. They actually improved the zipper, which is great. Now, the layout I've got set up here, and I haven't been in this since he delivered. He just brought it this morning. I've got a plywood box that I had a carpenter build for me. Well, actually, this guy was a contractor, but any handyman can build it. And it's just made of plywood that I picked up at Home Depot. And he just formed it into a box. And then on top of that, I've got a special kind of a mattress. This is a special mattress. You can't just buy it in any store. But what it is it's half a twin mattress, half a king mattress, excuse me. So it's a double extra long twin is what it's called. And you can actually buy this kind of mattress. It's super comfy. When you get in this, it is super, super like laying in bed. It's literally like laying in bed. Then inside, this is what I take. I take some lozenges here, rescue remedy lozenges. Those go inside. I take my cell phone inside. And I take my tablet inside so I can stream. And inside also, I have a nice pillow that I have, nice king size pillow I put in with a pillowcase. That's going to go in. And then I have a down comforter that I put inside. Now, if anything, these babies get too warm. So you don't need to cover up. What it does, it adds an extra layer of cushioning so you're not laying on the plastic of the chamber itself. And it makes it soft inside under your back. So this is super comfortable. And part of the reason I like it super comfortable is I know better because I'm a chiropractor. And I'm just saying, getting a setup like this wouldn't be so hard. It didn't run me that much money. The mattress is probably the most expensive thing. The box was about a couple hundred. The mattress is about, I think, 400 or 500. And the comforter, it's a twin size comforter down, cost me maybe $50. So the whole setup really isn't expensive. And, you know, if you're going to lay somewhere for an hour and a half every day, you want to be